Thank you, everybody, for being here. I am Liz Bankovich with the Buffalo Niagara Partnership, and today's speaker series is brought to us by Spectrum Health and Human Services, and it is all about the successful employee reentry plan. I think what's on our minds really all the time now is really how to increase engagement, really help with recruitment and retention, and you're going to spend the next hour with us learning all about that. Before we begin the speaker series, I want to just tell you about a couple of upcoming events. On July 20th, we have our third series with Vistage. It is Meta Trends in the Next Economy. For members, you can sign up. It's a complimentary speaker series. You can sign up today. And also, we have our BN360 program. This is also a popular session. How to set and achieve goals. This is July 22nd from noon to 1. That lunchtime series has been very popular with our young professionals, and we really encourage you to encourage your young professionals to attend. The partnership has exchange programs, which are leadership development programs that are worth mentioning. They are a series that happens throughout the year. Each follow a very similar format. They are 2 hours a month, professionally facilitated, geared towards specific audiences. They're very limited in size, which makes it easy to learn and develop. We have Leader Exchange, which is designed for developing managers. If you're in Leader Exchange, you have to be a manager with at least one direct report, 7 years of experience, whether it's in professional services or the private sector or not-for-profit. And Sales Leader Exchange is great. It's more of a curriculum. It's for sales leaders, sales managers, great session that will be launching again in January, but the class is starting to fill up. And Executive Exchange, we have 3 classes, 3 different facilitators. This is our longest running exchange program, designed for the C-suite, presidents, owners, VPs, high-level executives at any company. And Diversity and Inclusion Executive Exchange is great because it's really one of the few places where diversity and inclusion professionals can meet, share experiences, talk about initiatives, successes, best practices, et cetera. All of these are on our website. We really encourage you to take a look at them. And one last thing, we have the D&I Academy. This will launch again in the fall. This is designed for companies just getting started in D&I. All of these are popular. We would really encourage you to, if you have an interest, to start working on that today. So thank you for that. I'm going to turn this over to Spectrum Health and Human Services. I just want to tell you that we're fortunate today to have 2 professionals from Spectrum. We have Cindy Voelker, who's the Associate CEO, and we have Mark Hendrickson, who's the Senior VP of HR. I'm going to turn this over to Cindy, and after Cindy, Mark will speak. I'll also tell you we have a Q&A, time for your questions. So in the Q&A feature of this, please put your questions in. We'll have a few minutes at the end, and Mark and Cindy will respond, and anything that's on your mind is very welcome. So Cindy, take it away.
Okay, thank you. Next slide, please.
Sure.
Good morning, everybody. Thanks for joining us, and we're really pleased to be able to be with you and talk about this really important topic that we've been all dealing with. I just want to tell you a little bit about Spectrum first. Spectrum Health and Human Services has been around since 1973. You can see our mission statement there, and we are actually also a nationally certified community behavioral health center, which is really a center of excellence for behavioral health that is a model across the country. We are committed to providing services to all individuals in our community, and we have services across Erie and Wyoming counties, and we provide crisis services across 5 other counties. We have community-based services. We do urgent care for behavioral health at our Main Street location. We have 24/7 access to crisis counseling, and we've also been of New York State's Project Hope, which has been FEMA grant to help people get through the COVID challenges that we've all been faced with. So that's a kind of a little summary of what we do. So we do a lot, and we've been dealing a lot with increased demand during the COVID and post-pandemic time. So we've looked at that from both our employee side as well as the community and individuals looking for help and support. Next slide, please. So we thought we would just do a quick little survey just to get a little bit of a read on where all of you are at. So if you could just look at the questions here and answer, and then we'll have a little bit of a discussion about this near the end. Okay, I think everybody have enough time to finish those? I think we could move on then. When you think we got enough responses there, Liz? Okay, we can go to the next slide. There we go. Thanks so much. That will keep you busy there. So we're looking at this and thinking about what happened. So these are kind of a combination of all the things that we've been through. The coronavirus became an international devastation. It touched our lives, our community, our families, our economy. Pretty much everything that we were doing changed overnight. By the middle of March of the 2020, we were all working remotely mostly, except for frontline workers. We were schools shutting down, our economy shutting down, and really it was the beginning of our lives changing. And we kind of turned on a dime to have to make that adjustment. And so that's where we started. And now we're at the other side of this, trying to figure out what we do after that and what really is, as people like to say, the new normal, and how do we get back into life, which is, we're finding more challenging almost than the beginning of it. So we'll talk a little bit more about that. So if you could go to the next slide, please. So just to summarize, in Western New York, which I'm sure we're all aware of, up to about this point in time, about 128,000 people contracted COVID, 2,500 lives were lost, multiple scores of businesses closed or reduced hours of operation or are struggling to continue. Thousands and thousands of individuals started working from home. And as I said, none of our lives are the same. So we're going to talk a little bit about how that impacted everything, and especially towards the workforce. So next slide, please. This is just to add a little humor to the day, because I've heard a lot of people say this is a challenge for them, going back to work, and it won't be easy. And I'm sure all of you have seen a lot of cats and dogs and a lot of other things during the time that you were doing your Zoom or Teams meetings. Next slide, please. Okay, this goes to Mark now, Mark Hendrickson. He's our Senior VP of HR. I'm going to turn it over to you, Mark.
Okay, thanks, Cindy. Good morning, everyone. So as change continues, so is having to, adjust to post-pandemic strategies in areas of recruitment, retention, engagement. According to national surveys, it's estimated that 25 to 40% of current workers are considering a change in their position or career. Terms such as the Great Resignation, Tusami turnover have created near panic for many organizations across the country. The number one reason for the expected increase in resignations cited by most surveys is employee burnout. Research by Eagle Hill Consulting found that the majority of employees are burnout, including symptoms of exhaustion, mental fatigue, detachment from work, or feeling negative. During the first half of this year, employees seem more eager than ever to make moves, especially when they feel like they've lost an entire year's worth of progress in their own lives. So don't rely on a passive approach in retaining even your most loyal employees. Don't wait for dissatisfied employees to self-advocate, or worse yet, surprise you with a notice. The Bureau of Labor Statistics recently indicates that there are 9.6 million job openings as of current, projected by the end of August. Just after COVID began, there were 4.6 million job openings in April of 2020, as noted on the chart. Job openings essentially have doubled in the past 15 months or so, creating a challenging ratio of job openings versus available labor pool. So who has the upper hand? Many would think employees and job candidates. So what to do? Next slide, please. Some practical advice. My apologies. Some practical advice is to figure out what employees want or expect from your company. There are numerous national surveys out there that have been conducted recently to determine what the vast majority of employees want in this current environment. This meta-analysis is accumulation based off of recent trends and data points from collective surveys such as McKinsey, WeWork, SHRM, Inc., Eagle Hill, Achievers, and many others. The following are the key findings. Over half the employees said they want more flexible hybrid virtual working models where employees are sometimes on-premise and sometimes working remote. Most employees see telework and flexibility it provides as a key benefit and are willing to sacrifice substantial earnings for it. Employees want to work remotely half the time or more, generally speaking. Your company may remain split or indifferent about the balance between remote work versus in-person. Consideration of such workplace models would be driven by your company's business needs. Recent data from WeWork Workplace Intelligence survey suggests that 3/4 of employees are willing to give up one benefit perk for the freedom to choose their environment. Employees, by their own admission, are more productive on average when working from home. Over 2/5 of all employees, especially younger ones, would feel a concern over career progress if they work from home. Nonetheless, training, coaching, development of employees should be a priority for your company, even under a virtual platform. Employees may feel happier, more engaged, more willing to go the extra mile, feel less stressed, with more work-life balance, including the opportunity to work remote. Over 3/5 of all employees report poor virtual communication and collaboration as their biggest challenge with remote work. Next. Feedback from your employees is crucial to understand when tweaking or creating new policies or strategies, especially during a time as challenging as the pandemic. How does your company, your leadership team, and frontline supervisors create new policies and strategies, especially during the time as challenging as the pandemic today? What does your company, your leadership team, and supervisors do to determine workplace preferences and concerns? Administering pulse surveys, facilitating focus groups, one-on-one meetings will assist you in learning how to improve organizational culture, improve the overall employee work experience, understand remote work preferences, and take into consideration the creation of new policies. Employee feedback must render action. If you do not make an effort to dissect the feedback you receive and make changes to consider your employee needs, you may risk additional turnover. The employee's voice is crucial, but so is your response. At Spectrum, HR annually administers an employee satisfaction survey to determine such preferences. Over the past several years, we have averaged an 80% participation rate and uncovered some notable results, including an overall employee satisfaction rate of 80+%, a strong positive work relationship correlation between supervisors and employees, and appreciation for flexibility, benefit offerings, diversity, inclusion, and more. We have also progressed in training and development, IT infrastructure, and improved our culture overall. Next. So whatever your next workforce model for your company may be, consider future projections. In a recent McKinsey survey, this chart clearly suggests that most employees prefer a flexible model. Note the differentiation between pre-COVID and post-COVID preferences in work models. The preferences are vastly different. In summary, pre-COVID work models, including the combination of hybrid and remote work, consisted of 38% of the employees surveyed. Post-COVID preferences depict the same combination of hybrid and remote work at 63%, a 25% increase in hybrid and remote work. Next. So, an important topic, culture. Culture is at the heart of every company. Now is an important time to reassess your company culture, especially as employees re-enter the workplace. So what is organizational culture? By definition, a collection of values, expectations, and practices that guide and inform the actions of all team members. Culture is created through consistent and authentic behaviors, not just publications, news events, or policy documents. You can watch culture in action when you see how your CEO responds to a crisis, how your team adapts to new demands or challenges, or how a manager corrects an employee who makes a mistake. Organizational culture affects all aspects of your business, from punctuality and tone, contract terms, employee benefits. When the culture aligns with your employees, they're more likely to feel comfortable, supported, and valued. Consider now that wellness initiatives, benefit perks, and company values are being prioritized post-pandemic. Recognize employee effort. Employee recognition is one of the key elements in every culture. Next. So key step number one is excelling in recognition. Recognizing the contributions of all team members has a far-reaching positive effect on organizational culture. When everyone on the team recognizes the accomplishments of others, individuals start to see how they're part of the whole. This includes virtual recognition. When you make appreciating employees part of your culture, important metrics like employee engagement, retention, and productivity improve. Next, please. So other steps to creating a better workplace culture to increase retention and attract new employees. Measure the voice of the collective. Creating a culture that values feedback and encourages the employee's voice is essential, as failing to do so can lead to lost revenue and demotivated employees. Utilize listening tools that make it easy for employees to express what they're feeling in the moment, like pulse surveys or focus groups or one-on-one meetings, as mentioned earlier. Managers should treat all their sessions with employees as opportunities to gather and respond to feedback and act as a trusted coach. Make your leaders and managers culture advocates. Your company's success and building a strong workplace culture rests in the hands of team leaders and managers. For example, if your workplace culture prioritizes certain values and your leadership team doesn't exemplify them or even displays behaviors that go against them, it undermines the effort. Team members will recognize the conflict between stated values and lived behaviors. They may even start to emulate negative behaviors because they believe those behaviors have somehow been rewarded by management. When employees see leaders living the culture, they'll follow suit. Live by your organization's values. Live by your company values means weaving them into every aspect of your business. This includes support teams, HR policies, benefit programs, and even out-of-office initiatives like volunteering. Your employees, partners, customers, clients will recognize and appreciate that your company puts its values into practice every day. Connectivity between team members. Building a workplace culture that can handle adversity requires establishing strong connections between team members. Creating those bonds can be challenging. Encouraging collaboration and engagement in team building activities, even when remote, is preferred. Focus on development, training, and learning opportunities for employees. Exceptional workplace cultures are formed by employees who continually learn in companies that invest in staff development. Training initiatives, coaching, and providing employees with new responsibilities are all great ways to show your team that you're invested in their success. Organizations should hire for culture and reinforce it during the onboarding process and beyond. Practices and procedures must be taught, and values should be shared early and often. Personalize the employee experience. Your employees expect personalized experiences, so focus on ways to help each team member identify with your culture. Pulse surveys, again, focus groups, employee journey mapping, training plans, one-on-one meetings are great ways to discover what your employees value and what their ideal culture would look like. Organizational culture will develop without your input, but in the absence of that guidance, it may not be healthy or productive. Next, please. A recent report from Mercer says that while 48% of executives rank employees' well-being as a top workforce concern, only 29% of organizations actually have a health and well-being strategy. Anxiety, stress, mental fatigue are known to decrease work performance, reduce job satisfaction, and negatively affect interpersonal relationships with colleagues, among other things. So what can we all do? Say thank you more often, or appreciation of employees more often. Recognition builds lasting connections between people. Leaders instinctively know that the more human connection in a company, the better it performs. It's easy to see why receiving a thank you makes an employee feel appreciated. Check in with employees more frequently. Studies show that employees who check in with their manager at least once a week experience higher psychological safety than those who check in less frequently. And yet only 1/3 of surveyed respondents in the Work Human Survey said that they check in with their manager every week. Fortune 500 company IBM is taking the lead on changing that stat, emphasizing more frequent feedback from employees. CHRO Nicole Lamoureux cites it as one of IBM's top 4 priorities, saying feedback from employees is as important as growth, innovation, and inclusivity, because you can't have those first 3 elements without feedback. Psychological safety can become part of your hybrid workplace design as you return to the office. You may consider formalizing appreciation, thank yous, data-rich social recognition systems. You can strengthen diversity, inclusion, and belonging efforts by helping managers understand and mitigate unconscious bias. Imagine how much time and resource would be salvaged if your company moves the needle on psychological safety. There will never be a better time than now to build psychological safety into your culture. As HR leaders and other executives look towards the post-COVID economy, employee well-being will continue to be featured at the top of the list. Putting out workforce management related fires while being in crisis mode has shaped much of the past year and a half for most HR leaders. Looking after not only the legalities around managing employees, but also their well-being, are far more sensitive task. Next, please. A few comments on recruitment and retention. Social media can be a powerful recruiting tool. There are obvious social media platforms, including LinkedIn, Facebook, that many companies use as a recruitment method. As applications are ever changing, consider all options. Instagram, for example, is trending toward being the #1 social media platform with 1 billion monthly users in 2020. And that 90% of Instagram accounts follow businesses. However, Instagram remains largely untapped as a recruitment source. Consider added bonuses and perks, referral programs, signing bonuses, retention bonuses. Ease of completing an application should also be taken into consideration. Like many companies, Spectrum has an internal referral bonus program that rewards employees for presenting great candidates who ultimately become employees. It is our #2 recruiting source in the hiring of applicants. Safe hiring events. Consider virtual and on-site job fairs or career fairs that should be carefully planned and administered. Although these may be costly through marketing and advertising and time-consuming, some companies continue to pursue as a viable recruiting source. Increasing pay rates. If labor shortages are coming at the expense of revenue, many companies are advocating increasing the entry-level wages, for example, maybe an extra $2 or $3 an hour. And salary scales are continuously being reviewed. Get employees involved in your recruiting strategy. Studies have shown that employees recruited through internal referrals produce, on average, 25% more productivity than new hires recruited by other means. Invest in the applicants that you do have. Many candidates may not have the exact background you are looking for. It may be time to get creative with the applicants that you do have. Many companies are offering employment opportunities to younger people with no previous experience. They look beyond their lack of experience and invest in skills and development training that will help them in their position. This turns into an investment for you and them, which boosts retention and recruitment. Emphasize internal hiring, promotions, and expansion of skill sets. Internal mobility is up 20% since the onset of COVID, according to LinkedIn data. In addition, 50% of companies expect their recruiting budget to remain stagnant this year, while many anticipate their learning and development budget to increase. Look outside your traditional methods of recruitment. Let your providers, your reps, your suppliers know that you're hiring and could really use another team member. They won't bring you bad hires, typically, as it's a reflection on them. You can also contact temp and direct placement services. Be sure to let them know you're actively looking to fill positions immediately. Of course, another option is researching the local education community, universities, colleges, high schools, and trade schools. Align your employment brand and recruiting efforts. One key area. Position your company as the employer of choice to target groups of potential candidates. An employer brand refers to the perception of your current and potential employees have of your company. As an action item, employer branding involves deliberately establishing your company's values, your work culture, and personality to ensure they align with your ideal candidate's aspirations. What unique set of benefits do you offer your employees in return for these skills, capabilities, and experience they'll bring to your company? Your employer brand is made up of every touch point you have with the candidate and employees, from the first message you send to job candidates to your employees through exit interviews. And finally, focusing on internal growth is key. Focus on the talent that you already have. Experts know that companies who succeed and win in the long term are the ones that invest in their current teams. This not only aids in reducing costly turnover, it also supports recruitment. The investment in your team often takes the form of education and training, where you can offer growth through new skills, allowing them to advance their careers. Okay, next, I believe is Cindy's slide. Okay.
You know, Mark, I do not see Cindy. Cindy may have a technical glitch. Do you want to talk about the next slide?
Well, let me see if I can give her a quick text here.
Okay. And I would encourage our audience to put, oh, here's Cindy. Encourage our audience to put questions in the Q&A. Cindy is back up.
I'm
Thanks,
very
Cindy.
sorry. I don't know what happened, but typical for the world we live in, I got kicked off of Zoom and I had to relaunch it.
No problem. You're back on.
I'm back on now. Holy cow. Well, we're all used to that, right? So anyway, thanks, Mark. So to bring it around to kind of more of our real life experience here at Spectrum, a little bit about how our business changed, and I'm sure all of you have your own stories of how your business had to change. You know, for healthcare, we had to switch to telehealth very quickly. We had to help with technology. We had to find ways to do virtual visits. We had to provide all of the equipment for our staff at home. We had to turn everything on its head overnight and continue providing services. So all of our staff stayed employed, and 90% were working remotely for at least the first 6 to 8 months, except for the teams that were out in the community for our high need individuals that they were still visiting. So we did a lot of things to change our business, which I think is important because it required our staff to change their way of doing things. Well, we weren't even able to really see them face to face and kind of make a good plan. So it was kind of a critical time to be quick on the take of what you're doing. We also provided vaccination clinics at our locations. So we did a lot of things to try to support our individuals that we serve and work with, like I'm sure a lot of you have with your own businesses. So next slide, please. So with our staff, and I think this is a lot of where successful reentry. So for us reentry, we had a lot of people working in the community still, but a lot of people most working at home. What we found is we needed to provide a lot of emotional support, and we see that increasing as we're bringing more people back into the workforce. We've saw an increase of about 20% of demand for our services from the community, but we also saw more of our own staff struggling and needing to focus on how to provide emotional support, interactive processes where we could help problem solve, providing our EAP services, providing flexibility and support. As I'm sure you've all seen, problems with caring for other people in their family, problems with childcare, problems with jobs, just a real change in terms of the focus for our staff. We also wanted to get people back to work safely, so we did a lot of vaccination education, and we provided easy access to vaccines. That was really very helpful. About 85% of our workforce is vaccinated, and that made it, for a lot of people, feel safer coming back to work in the workplace. We did also change a lot of our settings to bring things up to speed in terms of the air quality, to provide, safety for people so that they felt assured that we were committed to people coming back to a safe environment. We also did not mandate vaccines, but we did educate and give updates and show the connection from vaccines to decreased COVID situations within our own organization. We have about 400 employees, and probably about close to 50 employees and some of their family members contracted COVID during the time period. So we were dealing with a lot of that ourselves, as well as with helping the community deal with that. Flexibility, I'm sure everybody knows and is tired of hearing that word, but return to work plans. We did a lot of surveys, survey monkeys, just to get a quick read on what people were thinking and wanting, and what they were to anticipate when they came back. How are we going to deal with that? And how are we going to support people, especially because we have multiple locations and multiple different types of services. It was important to kind of understand each area and have a plan that fit for those individuals in that location. So that was kind of challenging as well. I think the other thing is trying to maintain a lot of connection through Zoom and team meetings in Microsoft. We did a lot of that. Consistent supervision where you were actually connecting with that person, even if you couldn't see them face to face. And that is, we were able to bring people more face to face, begin to do that in a way that made sense, but also keeping some of the virtual things that also made sense and made life a little easier as well. I think the one big thing we found is communication is critical. When we found out something, we tried to communicate it. We put in a Monday morning minute where we sent out to everybody on our SharePoint sites. We updated information. We tried to give as much as we could, because things were changing and there was a lot of confusion. And I think in some of our feedback, the staff would say, it's very confusing. Why'd you do this? Why'd you do that? So I think trying to communicate why we were doing those things was helpful and helped make the transition a little bit easier. I will say, though, that the transition back has been more challenging, as I'm sure you're all either experiencing or anticipating, than it was the other way around. So we felt that, if you can go to the next slide, please. That we also felt that doing things for the community and connecting our organization and what our staff were doing to the community also was helpful. So we did a lot of things during that time with Community of Caring, which was actually a free online service for support activities that we provided to our staff and to our clients that we served into the community. We were involved in New York, and still are, New York Project Hope, which is actually free to all individuals, businesses, school systems. We've been to a lot of places to provide support and education, either as a group or individually, for impacts related to COVID. We expanded and provide easy access to services. As I said, we've seen a big increase in demand for people, anxiety, depression, domestic violence, drug abuse, and alcohol abuse going up. All of those things you would see in the media, we've seen actually happening in our own community. So we really have worked hard to expand and provide easy access to services. We've also got an education and training center that provides some of that education in the community and is open to others, not just our own staff. Next slide, please. So it's also good to have a little fun. So one of the things that we did during the COVID time, and one of the things that we are continuing to focus on, is stress relief for ourselves and our staff as they're coming back and dealing with life in a different way. So this is a day that we had some bubble blowing. We were celebrating mental health awareness. It was kind of a fun thing to do. Next slide, please. Oh, there you go. There goes the bubbles. Okay. So I think one of the things that we did during COVID and that I would recommend doing, and as you're bringing people back, is honor traditions that you have established, but make new traditions as well. We had an annual staff day. We did it virtually. We provided everybody with free access to getting lunch at home, an agenda, and recognizing individuals and connecting. And it was kind of surprising, even with almost 400 people, we were able to feel a better connection. And it was really kind of helpful to do that multiple times during this time. And even as we're coming back together more, to do that. Sending out birthday cards, anniversary cards, sympathy cards, we're reaching out to people who are sick or family members had deceased, trying to do more than we actually had ever done in the past to connect and support and have kind of a more of a strong connection emotionally to our employees. I think is something that we really focused on and will probably continue to focus on as we go forward. Maintaining regular contact and being connected is engaging people. So one of the things that our employees in our surveys, they really like the most about working here is they like their supervisors, surprisingly, they like their coworkers and they like the work they do. So working remotely and having a blended schedule, you have to find that balance of how to keep people engaged. So I think that those kind of things are all helpful, and those are things that we're going to continue to do more as we bring people back, because we do see an increase in people's stress level and anxiety, getting back to being around people all the time, dealing with other things. It's really kind of changed the way our workforce is in a lot of ways. The other thing that we are looking at also is the problems with retention and keeping employees. And it is true what you hear for us, people will just walk off the job. I can't do it. I can't take it. I need to quit. Not giving any notice, not being able to manage and handle the stress of the job. Unprecedented that we've seen. So we've been putting in place things when we hire people, touching base frequently, trying to provide a lot of that support up front and kind of, preempting some of the things that we know people are going to be going through. Next slide, please. So just to end on a little note, work appropriately, but be flexible without overly prescriptive guidance. One size shouldn't fit all. And I think that's difficult for a lot of us because we're used to kind of organizing and coordinating things and being prescriptive about how we want our employees to be, but that isn't kind of the world that we're seeing living in right now. So how to adapt to that, like everybody's had to adapt to a lot of things, has really been critical to trying to keep our workforce engaged and bringing on new members and bringing them into the workforce. So those are some of the things that from the operations side that we've been doing. Maybe we could look at the survey results and have a little bit of a discussion about some of that. So let's see, what's your current workforce model? All remote is 28%, all on site 8%, and hybrid is 64%. So it's kind of right on with the statistics Mark was showing about people who want a hybrid, situation for their work environment going forward. Was this your model before March 2020? no, 84%, and 16% said yes. So as we can see, that's clearly the changes that we've been through. And what do you consider to be the biggest challenge for the second half of 2021 and beyond? I can't see the answers myself. Can we move that up a little? Maybe not. Well, it says employee compensation 0%, so I don't know.
See recruitment and retention.
Cindy, I can name them for you.
I can't see it on my screen for some reason, sorry.
Oh, okay, I can name them, no problem. The question is, what do you consider to be the biggest challenge for the second half of 2021 and beyond? Employee compensation is at 0%. Recruitment and retention is at 68%. That's the largest percentage here. Realigning workforce strategies at 16%. Engaging employees at 12%. Health and welfare of employees, 4%. So handedly, recruitment and retention at 68%.
Okay, thank you. I didn't realize the arrow was on my screen.
That's okay.
So I think that at least for us, this is consistent with sort of how we would see our own work environment. And I'm thinking that obviously it is with all of you. Recruitment and retention is probably the biggest challenge that we're all facing. And I think that we feel that addressing some of the emotional and mental health needs of our employees, addressing the need for flexibility, and providing an environment that people want to be at is kind of critical going forward. So I guess we'll look at see if there's any questions that people had or any comments or dialogue.
Cindy, a question came in to me. If you don't mind me asking you, let me just get my camera here. Okay, great. Someone sent me a message that said, if you look on Transit Road or any restaurant on the weekends or Thursday night, people are just back to quote unquote normal. There's large crowds, there's people at restaurants that are sitting right next to each other. But yet you may talk to the same people or similar people that are hesitant about actually going back to the office. What do you suppose that is really all about? Because there seems to be a real demarcation line of work and play when it comes to safety.
Well, I would say that we have had some of those similar discussions and kind of those observations throughout, these challenges. And I think a lot of it has to do with people wanting a different work life. People are not as comfortable and not as interested in returning to the structure and the work life that we've all been used to in the past. So I think that's the challenge that we're finding right now, is how to create a different work life and a balance that also meets or exceeds what we need from our employees, but also keeps them engaged and wanting to be part of that workforce. So I think it has to do more with people liking, in some ways, the flexibility and the different things that you got from being able to work in a hybrid or fully remote manner. And so they're just, I think, saying you're uncomfortable is maybe more about a lot of other things than it is about just the virus at this point in time.
Yeah, it would seem so.
Mm-hmm.
Another question here. It's kind of an interesting flip, and it's really employer based. So when people are returning back to work, do they talk about, or do they relax a little about what working remotely challenges their work? Because what you seem to see now is many people don't really talk about any remote challenges. Is that fair? Is that true? Is that just people saying overwhelmingly, whatever they are, I just rather, be home? Have you, since you're back, have you seen any of that, or through the work that you're doing?
So I think that we have seen probably less people offering concerns about working remotely mostly because the people who want to be back at work more are, and they're happy with that. The other people want to continue to work remotely. So my take on that is, and we've seen it with some of our own employees, is that they're motivated to make it work better. And so there's kind of a little less problem there. And really for us as an organization, when there were people struggling with performance remotely, we have made them, come in, and it kind of is a benefit if you have good performance to be able to work remotely, if we can manage that. So it seems to me that there's less concern about that, mostly because I think there's more, for more people, there's more of a hybrid model, but also because if you're doing it at home, you're used to it and you're more motivated to do it, I think.
Yeah. I think, Mark, maybe it was you that you touched on something that caught my attention about air quality. Are you, I think in the beginning of the pandemic, when there was talk about going back to work, there was all kinds of assessments about air quality in organizations. Do you think that employees are you seeing that employees are really demanding that there is some report on whatever their systems are or an upgrade in systems? Is there anything you can help employers with as far as what you think the employees want?
Liz, to be honest, I haven't heard that as a frequent, discussion point amongst employees. I know safety is a big concern between purifying systems and, those things would all be considered. If there was
I will say, I think it was actually, it was me that said that
Okay.
in the presentation. And I think that a little bit of difference is some of our sites where we see a lot of patients on site. And as you all know, in the healthcare world, you still have to wear masks on site all the time in terms of, not just determining whether someone's vaccinated or not. Now our numbers are low in our area, so that's good. But I think in the sites where there's a lot of people coming and going that we don't know, there is still anxiety about that a little bit with people. And so we did change over the air quality, and there were people asking about that in the midst of the pandemic about wanting to come back. They didn't want to come back if there wasn't. But I think now people are feeling another level of comfort. But I will say, we're all cautiously getting through the summer and seeing what happens. I think when you've been through the pandemic, you kind of like keep it in your back pocket thinking, well, let's see where it all goes and what happens. But I think it did help to reassure people that we were concerned about their safety and taking some of the requirements that were out there seriously and listening to what their thoughts were, even at times if we thought maybe it was, maybe not as valid as maybe they did, but trying to take it a little more, kind of seriously and provide information about what we did for those things.
Yeah, and this is a question from our audience. Has the policy changed as far as coming to work when sick?
Oh, yeah, ours did.
Yeah.
I can talk a little bit, Mark, and you can add to it, but during COVID, you weren't allowed to come to work if you were sick at all. And we, we're screening much more diligently about that and monitoring that. And then also, trying to, make sure people had the support to stay home and work remotely, or make sure they got paid if they, rather than come to work sick. So I have seen a shift in that, thinking from our perspective as managers. And also even saying to people, look, if you also need a mental health day, it's okay to say that, which is something that you'd think being a mental health organization would be okay. But we all still work on those ideas. But during COVID and post-COVID, we've even said that's okay. Because sometimes when you're calling in, we've asked people to tell their supervisor what's wrong. Why are you not coming to work? And Mark can speak to, we did change our policy around some of that, and our support, it goes through our nursing staff, so they kind of help screen that with people. But yeah, that has been something we've paid a lot more attention to.
I'll tell you, this is such an important question, because pre-pandemic, if an organization did not have a work from home policy, or I shouldn't say policy, but a work from home culture, you would really call in sick because there wasn't that opportunity. And now this is great for employers out there, because this is worth discussing.
We saw a huge decrease in the amount of sick time being taken by our employees.
Oh, when you came back, or
No, when they
during the
were able to
pandemic?
work during the pandemic, and even now when you're able to work remotely. So if you're not feeling well and you can stay home and still work, so more people were
Right.
inclined to do that than they were to call in sick. So we have seen that. That's going up a little bit now with people coming back on site. But I think that ability to allow people, even if you can't have a hybrid schedule routinely, the ability to be flexible when someone would benefit them to work from home and you can still do your work is something new for us that we've really seen a benefit on both sides too.
Yeah, that's good. And for companies that have a hybrid approach, but the work from home are specific days, it's really worth discussing this, because if it's not your day to be home,
Mm-hmm.
do you really, if an employee can actually work from home, do you really want them to take a PTO day? I mean, that's all part of the
right.
employee engagement. So that's a great question, Paula, because that's a question we as employers should all explore.
And I think if any of you haven't brought most of your employees back yet, it is challenging. There's a lot. It is challenging and preparing for that and trying to look at all these needs and trying to do it is really helpful, at least from our perspective, because I don't know, you find a lot of people having their own post-COVID traumatic kind of things that happen, but also anxieties. And it is interesting that, the dichotomy of seeing people, out all over the place, but, that's.
Yeah.
It's kind of
and for, I'm sure people in the audience can identify with this. People that talk about work and going back to work, and then that they're out and about. So, I know that it probably exists on a much larger scale. So I'll just say to the audience, we have time for one more question. So if you have something on your mind, just pop it in the Q&A right now. That would be great. And I do have another one that came in. You had mentioned, and if you could expand on this a little, I think, Cindy, you had mentioned education training sessions.
Mm-hmm.
What is that? Who is that for, and what does that relate to?
Well, so we recently rolled out a Spectrum Education and Training Institute, which actually provides training and consultation and education beyond just our Spectrum employees. It's actually on our website. So we could do, trainings around a lot of topics or consultation about dealing with, workplace situations around any of the things we've talked about today. And, we've done a lot of diversity trainings. We've done dealing with COVID situation, dealing with return to work things with our own employees. So we're looking to actually roll that out as a resource in terms of if anybody has an interest as a business, or individuals to reach out to us for that as well. So we do have it on our website. So, there's sometimes useful things that you could gather from that. The other thing is that organizations like us, Spectrum, and then, there's other Horizon, Best Self, if, that provide services for people. If you have employees who need more support than you can offer returning to work, just for anxiety, depression, family conflicts, those kinds of things. We have seen more of that. And, that's a resource in the community as well.
Well, very good. To our audience, we will send you a note with Spectrum's website address, so you can check that out. Actually, that's great to know. These are the kinds of things that sometimes, employers don't know about. So that's a great resource. I want to thank you, Cindy, and thank you, Mark. We appreciate your time today. Valuable information, food for thought for all of us, and we hope for everyone in our audience, it's about to transition that hasn't already. Best of luck, and you can certainly use Spectrum with any questions or concerns. They'd be happy to help you.
Thank you. Thanks, everyone.
Great. Thank you. Take care.